Bismillahirrahmanirrahim. The quote of the day is I am a great believer in luck. The harder I work, the more luck I have. A quote by Thomas Jefferson. Today, the topic of presentation is measures for health protection of workers and prevention of occupational diseases under the supervision of Professor Dr. Saira Afzal. The learning outlines of today's presentation is introduction of occupational health, health promotion of workers, measures for health protection of workers, medical and engineering measures for prevention of occupational diseases, legislation of workers, recent updates, and the MCQs. By the end of this presentation, participants will be able to describe what is occupational health, or how health promotion can be achieved in workers, various medical and engineering measures to prevent occupational disease, and labor rules for the workers. Now, what is occupational health? The modern definition of occupational health by International Labour Organization and WHO is the promotion and maintenance of highest degree of physical, mental, and social well-being of workers in all occupations, that is the total health of all at work. Now, the employee well-being is based on the physical, mental, financial, and social well-being. The physical factors that include are the physical body, ensuring a person has the freedom, opportunities, and resources needed to substantially maintain bodily health, while the financial states are the state of a person's finances, ensuring that a person feels capable to handle their financial situation and behaviors, and the ability to live productivity and without the weight of financial stress. While in mental well-being include the psychological ability to cope with information, emotion, desires, and stressors, for example, change, threats, and others, in a healthy and balanced way. It is essential for day-to-day living and functioning. While in social parameters include the state of personal and professional relationships, including personal and community engagement, and the capability of genuine, authentic, and mutually affirming interactions with others. Now, the International Labour Organization has some standards and policies. The International Labour Organization standards on occupational safety and health and International Labour Organization policy in occupational health reflect the following three core values. That is, the work should be take place in a safe and healthy working environment, and the conditions of work should be consistent with the workers' well-being and human dignity. Work should offer real possibilities for personal achievement, self-fulfillment, and service for the society. Now, the health promotion. Scientific evidence shows that in long-term work-related stress can contribute to musculoskeletal disorders, hypertension, and cardiovascular diseases. It may also alter immune functions, which in turn can facilitate the development of cancer. More widely, it can lead to indirectly to problems in and outside the workplace, such as violence, the abuse of drugs and alcohol, strained family relationships, depression, physical and mental health disorders, and even suicide. However, the early detection and appropriate treatment of incipient occupational and non-communicable diseases will reduce mortality and lower the frequency and extent of residual disability from many of such diseases. The prevention of occupational accidents and diseases, the promotion of a healthy working life, and the building of a preventive culture is shared responsibility of governments, employees, workers, health professionals, and society as a whole. Health promotion in workplace contributes to the improvement of work organization and the working environment. Social dialogue and the active participation of social partners in the improvement of working conditions at the workplace level. The promotion of health among all workers, their families, and their communities. The encouragement of personal development and well-being by enabling workers to reach a higher level of self-determination concerning their health and its improvement. Health promotion benefits both the workers and the employer. Um, Health promotion improves the workplace productivity and performance, the long-term well-being of workers and their families, and reduces the pressure on health, welfare, and social security systems. When health promotion at workplace is effective, it complements occupational safety and health measures to prevent accidents and diseases and to protect workers' health. Action is taken based on analysis of health requirements and needs of an enterprise. Employer workers and their representatives are involved. Activities in this area seek to improve the quality of working conditions and work of organizations focusing on healthy behaviors. International Labour Organization and WHO recommendations on occupational health. The measure for general health protection of workers was the subject of discussion by ILO and WHO Committee on Occupational Health in 1953. The committee recommended the following measures that are the nutrition, communicable disease control, environmental sanitation, mental health, measures for women and children, health, education, and family planning. These are discussed further in the presentation. First is the nutrition. The nutrition of workers must be a concern of occupational health programs. All workers should be nourished adequately, including any special demands. To achieve this, workers should be paid handsome pay package to purchase food for himself and for his family. Workers should be educated about the composition of a balanced diet. Facility of a canteen at workplace when workers exceed certain numbers and provision of a subsidy on food. A separate and good sanitary conditions dining room for meals is a good practice. Facility for storing food in uncontaminated conditions should be provided. Second is the communicable disease control in the workplace. The industry provides an excellent opportunity for the early diagnosis, treatment, prevention, and rehabilitation. It is a general objective everywhere to detect cases of communicable diseases and to render them non-infectious to others by treatment or removal from the working environment or from the both. There should be an adequate immunization program against preventable communicable diseases. Anthrax, indolent fever, and Q fever are examples of communicable diseases which may be of occupational origin. Their control calls for special sanitary measures in the handling of working materials and substances. Third is the environmental sanitation. Within the industrial establishment, the following needs attention for the prevention of the spread of communicable diseases by food, water, or other means. Water supply. A sufficient supply of wholesome drinking water is one of the basic requirements in all industrial establishments. The common glass tumbler for drinking water should be abundant as it spreads infection. Installation of drinking water fountains at convenient points should be encouraged. Food. If food is sold, its sanitary preparation, storage, and handling are essential. Education of food handlers and other measures may be necessary to prevent outbreaks of gastrointestinal diseases. Toilet. It is recommended that there should be at least one sanitary convenience for every 25 employees, and, and they should be separate for the males and females, and for the 21 latrine for 25 employees for the first 100 employees, and thereafter uh, above the 100, one toilet for the 50 persons. General plant cleanliness. The walls, ceilings, and passages should be painted with water washable paint and repainted at least once in 3 years and washed at least once in every 6 months. The dust which settles down on floor and machinery should be properly removed. Sufficient space. Sufficient floor space and cubic space are essential to prevent not only respiratory infections but also to ensure a comfortable working environment. The recommended standard is a minimum of 500 cubic feet of space for every worker. Lightning. The results of poor industrial illumination are workers' eye fatigue, increased accidents, decreased production, and more rejections of finished products. Furthermore, defective illumination over a long period of time may result in permanent impairment of vision. There should be sufficient and suitable lighting, natural or artificial or both, in every part of a factory where workers are working or passing through. Seventh is the ventilation and temperature. Poor ventilation not only increases the chances of infection from person to person but also affects the mental and physical efficiency of the workers. It is a protection against hazards. There should be adequate environmental controls designed to protect the workers against exposure to dust, fumes, and toxic hazards. Ninth one is the housing. There is usually an acute shortage of housing in industrial areas. Most workers come from rural areas. The housing of workers near a plant must be correlated to essential community amenities and to social and sanitary facilities. Town planning and zoning are highly desirable. Fourth is the mental health. The goals of the mental health industry are to promote the health and happiness of the workers, to detect signs of emotional stress and strain, and to secure relief of stress and strain where possible, the treatment of employees suffering from mental illness, and the rehabilitation of those who become ill. Mental health is more than the absence of mental illness. Mental health aids in coping with stress. Workplace wellness must be a top priority, and you cannot have health without mental health. Human performance and mental health go hand in hand. The measures for the women and children. Women workers require special protection because the developing embryo may be more susceptible to noxious agents than the exposed mother. For example, in case of methyl mercury poisoning, females may be less suited for some work tasks than the men. The infant mortality is higher amongst children of women employed in industrial work. Following provisions should be given to women: paid maternity leave of 12 weeks and provision of free antenatal, natal, and postnatal checkups, prohibition of work at night, prohibition of work in dangerous occupations like mining. The minimum age for employment in Pakistan in various provinces are: in Punjab, the minimum age is 15 years, while in Sindh and KPK, it is 14 years. In Balochistan, it is also 14 years. Minimum age for hazardous work in Balochistan is still 14 years, while it is raised to 18 years in rest of the provinces. Health education. Health education in industrial setting should be invested at all levels of the management, the supervisory staff, the worker, the trade union leaders, and the community. The content varies from matters of personal hygiene and protection to participation of workers in the planning and operation of the total health service program in the industry. Last is the family planning. Family planning is now recognized a decisive factor for the quality of life, and this implies to industrial workers also. The workers must adopt the small family norm. Now, second part of the presentation is prevention of occupational diseases. And the various measures for prevention of occupational disease may be grouped under the three headings that are medical measures, engineering measures, and legislation. Now, the medical measures have seven components. First is the pre-placement examination, then periodical examination, medical and healthcare services, notification, supervision of working environment, maintenance and analysis of records, and health education and counseling. First is the pre-placement examination. The purpose of pre-placement examination is to place the right man in the right job so that the worker can perform his duties efficiently without detriment to his health. That is also known as ergonomics. It is run at the time of employment and includes the worker's medical, family, occupational, and social history. A thorough physical examination and a battery of biological and radiological examinations, for example, chest X-ray, electrocardiogram, vision testing, urine and blood examination, special tests for endemic diseases. A fresh recruit may either be totally rejected or given a job suited to his physical and mental abilities. The following is a list of some occupations in which it is risky to employ men suffering from certain diseases. For example, if a person is suffering from anemia, hypertension, nephritis, or peptic ulcer, he should not work where lead is used. And if a person is suffering from asthma, skin, bladder, and kidney disease, and precancerous lesions, he should not work in industries where dyes are used. And if a person is having healed or active tuberculosis lung or chronic lung diseases, he should not work in industry where silica is used like sandblasting or marble or others. Or if a person is suffering from signs of ill health, especially any blood disease, he should not work in radium and X-ray settings. Second is the periodical examination. Many disease occupational regions require months or even years for their development. Their slow development very often leads to their non-recognition in the early stages, and this is harmful to the worker. This is the reason why a periodical medical checkup of a worker is very necessary when they handle toxic or poisonous substances. Particular care should be given to workers returning from medical leave to assess the nature of and degree of any disability and to assess the suitability or otherwise of a returning to the same job. Third is the medical and healthcare services. The medical care of occupational disease is a basic function of an occupational health service. Social Security institution in Pakistan provides medical care not only for the worker but also for his family. Within the factory, the first aid services should be made available. Properly applied first aid can reduce suffering and disability and hasten the recovery. Fourth is the notification. The main purpose of notification in industry is to initiate measures for prevention and protection and ensuring their effective application. To investigate the working conditions and other circumstances which have caused or suspected to have caused occupational diseases. Fifth one is the supervision of working environment. The physician should pay frequent visits to the factory in order to acquaint himself with various aspects of the working environment such as temperature, lighting, ventilation, humidity, noise, cubic space per person, air pollution, and sanitation which have an important bearing on the health and welfare of the workers. He should be acquainted with the raw materials, process, and products manufactured. For studies of this kind, the physician should enlist the cooperation of safety engineers, industrial hygienists, and psychologists. Sixth is the maintenance and analysis of the records. The worker health record and occupational disability record must be maintained. Their compilation and review should enable the service to watch over the health of the workers, to assess the hazards inherent in certain type of work, and to advise or improve the preventive measures. Last is the health education and counseling. Ideally, health education should start before the worker enters the factory. All the risks involved in the industry in which he is employed and the measures to be taken for personal protection should be explained to him. The correct use of protective devices like masks and gloves should also be explained. Simple rules of hygiene, hand washing, paring the nails, bodily cleanliness, and cleanness of clothes should be impressed upon him. He should be frequently reminded about the dangers in industry through the media of health education such as charts, posters, and handbills. Now the engineering measures. Engineering measures are discussed on the following headings, which are discussed one by one. First is the design of building. The type of floor, walls, height, ceiling, roof doors and windows, cubic space are all matters which should receive attention in the original plan of the building which is put up by the industrial architect. Good housekeeping. It covers general cleanliness, ventilation, lighting, washing, food arrangements, and general maintenance. Good housekeeping is the fundamental requirement for control or elimination of occupational hazards. To prevent accidents, the right thing should be on the right place. General ventilation. It has been recommended that in every room of a factory, ventilating openings shall be provided in the proportion of 5 square feet for each worker employed in such room. Openings shall be such as to admit a continued supply of fresh air. In rooms where dust is generated, there should be an efficient exhaust ventilation system. Good general ventilation decreases the airborne hazards to workers, especially the hazards from the dust and gases. Fourth one is the mechanization. The plant should be mechanized to the fullest possible extent to reduce the hazard of contact with harmful substances, such as dermatitis can be prevented if hand mixing is replaced by the mechanical devices. Acids can be conveyed from one place to another through pipes. Fifth one is the substitution. Substitution of white phosphorus by phosphorus sesquisulfide in the match industry, which resulted in the elimination of necrosis jar, that is foci jar. Zinc or iron paints can be used in place of harmful lead paints. Substitution is basically the replacement of the more toxic substances with the less toxic substances so that the health hazards can be minimized. Six is the dust. Dust can be controlled at the point of origin by water sprays, for example, wet drilling of rocks. Inclusion of a little moisture in the materials will make the process of grinding, sieving, and mixing comparatively dust-free. And enclosure. Enclosing the harmful materials and the process will prevent the escape of dust and fumes into the factory atmosphere. Grinding machinery can be completely enclosed. Such enclosed units are generally combined with exhaust ventilation. It is a isolation. It is necessary to isolate the offensive process in a separate building so that workers not directly connected with the operation are saved from the exposure. Last is the protective devices. The protective devices comprise the respirators, earplugs, earmuffs, helmets, safety shoes, aprons, gloves, gumboots, barrier creams, screens, and goggles. The worker should be instructed in the correct use of protective devices. On the legislation, society has an obligation to protect the health of the worker engaged in diverse occupations. It has grown out of realization that the worker is more important than the machine which he operates. The worker cannot be permitted to endanger his life and live in an occupation while the employer makes a fortune. Factory laws therefore have been framed in every country to govern the conditions in industry and to safeguard the health and welfare of the worker. Laws of occupational health in Pakistan. There is no independent legislation on occupational safety and health issues in Pakistan. The main law which governs these issues is the Factory Act that described in 1934. All the provinces under this act have devised the factory rules. Khyber Pakhtunkhwa and Sindh have enacted the factory legislation in 2013 and 2016 respectively. Directorate of Labor Welfare of Pakistan. And these are also the following are also the laws for the labor welfare of in Pakistan. Now, the Director General of Labor Welfare Punjab. It is a focal agency for implementation of labor laws in the province. It has a wide range of functions and responsibilities that are given below. First is the maintenance of industrial peace and harmony in the province of Punjab, settlement of industrial disputes through the process of conciliation, arbitration, and adjudication, coordination with district labor and human resource boards, dissemination of labor market information, and implementation of government policies in this regard, adju- adjudication of claims and compensation and cases of non-payment of wages, conducting of referendums for determination of collective bargaining agents and supervision of election proceedings of trade unions and federations, audit and scrutiny of annual returns, funds of trade unions and federations, enforcement of labor welfare laws on factories, transport, railway, shops, commercial and industrial establishments, implementation of government policies and programs for the gradual elimination of child labor, coordination of government efforts combating the issue of child labor and bonded labor. Registration and deregistration of factories, shops, and commercial establishments, enforcement of weights and measures laws on factories, shops, establishments, including petrol pumps, training in various disciplines of industrial relation, administration, and financial management to the departmental functionaries, trade unions, and management representatives at industrial relation institutes, provision of training, information, and advisory services to the industry for improvement of safety, health, and working environment of the working conditions and environments, distribution of merit grants, talent scholarships, mineral grants, management and distribution of education, allotment of plots and estate management of labor colonies, promotion of employment opportunities, collection and dissemination of labor market information and assistance to the defense forces by provision of data on skilled personnel. The Punjab Employees Social Security Institute. Punjab Employees Social Security Institute is an autonomous body under the administrative control of Labour and Human Resource Department under the Punjab Government Rules of Business 1974. It is established through the Provincial Employees Social Security Ordinance in 1965. Provision of health facility to the worker and their dependent is covered under the provincial social security laws. The Provincial Employees Social Security Ordinance 1965 requires the employees to contribute 6% of their wages of their employees having wages up to rupees 22,000 to the Punjab Employees Social Security Institution. Now the benefits provided by the Punjab Social Security Institutes. These are the medical benefits and the others. In medical benefits, the medical facilities included comprehensive medical treatment in social security hospitals and the facilities not available in social and the facilities that are not available in social security hospitals are arranged through other hospitals at the cost of Punjab Employees Social Security Institute wherever those be available. In case the required facilities are not available within the country, the same are managed abroad to cater the health requirements of the secured persons. Now, the cash benefits that are given by the Punjab Employees Social Security Institutes are sickness benefits, injury benefits, iddat benefits, maternity benefits and gratuity, disablement pension, survivors pension, artificial parts, funeral grant, financial assistance, free education of skilled workers, children. Labor Day. Labor Day is celebrated in most parts of the world on 1st May every year. Labor Day is an annual holiday to celebrate the achievement of the workers. Now the recent updates. The first article on the recent update is the impact of fringe benefits on employer performance, a study of NASCO Group, Jos Plateau State. Findings from the study show that health protection benefits have a positive and significant impact on employer performance in NASCO Group It showed that the more health protection benefits are provided for the employees of NASCO Group, the more they work hard at their jobs and their productivity increases. Retirement benefits have a positive and significant influence on employer performance in NASCO Group. And lastly, findings from the study revealed that the recognition has a significant impact on employer performance in NASCO Group. It will help them to create a sense of loyalty and encourage their productivity in the company. The second article is the overwork related disorders in Japan. Recent trend in development of a national policy to promote preventive measures. Overwork related disorders such as cerebrovascular and cardiovascular diseases and mental disorders due to overwork are a major occupational and public health issue worldwide, particularly in East Asian countries. This report discusses the recent trend of overwork related disorders in Japan from the perspective of workers, compensated occupational diseases, as well as the development of a national policy for preventive measures against overwork related disorders in Japan. Recently, the number of claimed and compensated cases of occupational mental disorders has increased substantially, particularly among young workers as compared to those of occupational cerebrovascular and cardiovascular diseases. In response to these situations, the action from society, the Japanese government passed the Act on Promotion of Preventive Measures Against Roshi and other overwork-related health disorders in June 2014 to help develop a national initiative towards the prevention of overwork-related disorders. Changes in the trend of overwork-related disorders in Japan under a legal foundation and an initiative by the central government should be closely monitored so that other countries can benefit from their experiences. Now the time for the MCQs. First MCQ is a person applied for a job in sandblasting factory. During his pre-placement examination, he is found to having pulmonary tuberculosis. What should be next plan regarding his job? Whether he should be rejected and asked to work in other sandblasting industries, or he is rejected and advised to do some other job in other kind of firms, recruited and advised to get medical treatment, and recruited on low wages as he cannot work properly. Which is the correct option?
B.
Yes,
B.
B is the correct option. Second MCQ is Mr. John works in a cement factory where his work is to load cement bags on loading trucks. While loading trucks, he got severe back pain. The physician, after investigation, diagnosed that he suffered from a disc sleep. He advised a medical leave of 2 weeks. What is recommended to do when he returns back to work? Whether he join his previous work immediately, medical examination after the leave initially, then the decision is made, or he can't do any type of work now, or he is fit for any type of work. Which is the correct option?
B. B.
Yes, B is the
B.
correct option. When a person comes after medical leave, his medical examination can be done again to assess his medical fitness. Third MCQs, which of the following health indicator is not included in International Labour Organization and WHO definition of occupational health, whether it is physical, mental, social, or economical?
D.
Uh, Physical, mental, and social well-being are under the definition of occupational health, while economical is not under the
D.
definition of
D.
occupational health. Yes, D is the correct option. A new factory worker is planned to cotton factory is planned to be constructed in a town where 80 laborers will work. How many toilets should have to be built in that factory? Whether it should be 1, 3, 5, or 7. B is the correct option.
7.
Uh, 3 toilets are needed for a laborers of 80 laborers. One toilet is necessary for 25 laborers, as in this scenario there are 80 laborers, so the provision of 3 toilets are necessary for the 80 laborers. Fifth MCQ is which of the following medical and engineering measures is of no use for the health protection and prevention of occupational disease in workers? Whether use of less toxic substances, use of plastic pipes for transportation of acids, good ventilation of plant, or the dry cutting of marbles? Which is not useful?
D.
Yes, D is not useful.
D.
Dry cutting of marbles may cause silicosis, so it should be replaced by the wet cutting of the marble by water spraying. Sixth MCQ is a new mobile assembly unit is planned to be constructed. Which of the following measure is of no benefit for efficient and productive performance of workers, whether profession of retirement benefits, good lighting in working rooms, minimum working space of 50 cubic feet per worker, or the facility of a canteen.
A.
Uh, which is the not the correct option?
C.
Yes, C is not correct, as the minimum working space per worker is at least 500 cubic feet. A textile factory is recruiting 500 new workers. Which of the following things shall the factory work owner keep in mind while recruiting the workers? Whether he should have to equally appointing the male and female staff on night shifts. All the factory employees should be 12 years or more. Facility of weeks 10 weeks paid maternity leave or minimum wage of rupees 22,000 per month.
A.
No, D is the
B.
correct option. Uh, while all the others are wrong, because female staff should not be appointed on the night shift, and the minimum age should be about 15 years, and the maternity leave should be given for at least 12 weeks. So in Punjab, the minimum wages per month is 22,000 per month. 8th MCQ is a firm where 1,500 workers are contributing, hired a physician for periodical medical examination of workers. Which of the following is correct regarding periodical examination? Whether no need of periodical examination and workers are already evaluated during pre-placement examination, no need to evaluate those coming back after medical leave. It is compulsory as some disease present late or require months or years to help. It should be done at least after 2 years. Which is the correct
C.
option? Yes, C is the correct option. Ninth MCQ is engineering approach is followed to prevent accidents at workplace by giving due consideration to physical and mental limitations of the workers by whether by imposing too many safety rules, not permitting to make safety devices, giving first aid in case of injury, or giving constant attention to how a worker is likely to react.
A.
Delta is the correct option because engineering measures are designed according to uh, how worker react to the hazards. 10th MCQ is which preventive measures are of no use to control the spread of communicable disease in workplace, whether the common glass tumbler for drinking water, vaccination of employees for preventable communicable diseases, our workplace should be free of dust, flies, and mites, or a common dining room for lunch inside the workplace. Which is not the preventive measure for controlling the communicable diseases?
D.
Yes, D is the right option, as there should be a separate dining room for the meals to control the spread of infections. This is the key of the MCQ. These are my references of presentation, and thank you very much.
Thank you very much, Dr. Awais. Very nice presentation. And today I have seen that more and more work is required as far as international law organization laws are concerned, and WHO global workforce. There are different types of WHO documents that are available, and still they all need further international guidelines in order to make the things much better in place for occupational health. As we all know that there are more than 45% of the world's population, and majority of them are in global workforce. And when we talk about the age, we know that the population over 10 years of age, their count then increases to 58% of the population. So they are engaged in some type of the occupational health hazards, and there are certain things that are fundamentally required, especially for improving the condition of the work and their organizational productivity and the socio-economical and sustainable development. So, as you have presented that the occupational health and safety hazards are very common, especially in the developing countries like Pakistan, where the large number of the workers, they are not registered. Many people who are over 10 years of age, they may be declared as the child labor, but still their ages, their CNIC and other important documents, they are not registered with any important organization. If we compare the International Labor Organization laws and the documents produced by World Health Organization, we found that the two of them, they have contributed immensely to occupational health and safety. However, there is a large gap. Still, more research, evidence, and safety measures are required. So the main focus, or if you ask me what is the main focus of international law organization activities, then I would say only one thing, that is the provision of international guidelines so that the legal framework can be developed. And the legal framework, whenever it is developed, it is never ever can be implemented without the support of the government. And the